Thank you. I'd like to call the Health and Human Services Committee meeting of June 28th, 2022 to order. Madam Clerk, please call the roll.
Alderwoman Green. Alderman Gunther.
Here.
Vice Chair Middlebrook.
Present.
Alderwoman Rice.
Present.
Alderman Todd.
Present.
Chairwoman Ingracia.
Present.
5 present, you have quorum.
Thank you. Next up, we will move to board bills for review. Alderwoman Rice, you are recognized on Board Bill 61.
Nice. Thank you so much, Madam Chair. Thank you, members of the committee, for being here today for this hearing. Board Bill 61 is an allocation of ARPA funds that we're seeking to allocate in three separate tranches here that are a part of allowable expenditures by the by ARPA. I'm trying to get my brain together here this early afternoon. We know in Missouri that healthcare is vital, and healthcare encompasses everything from reproductive services to care after a child is born, to maternal health care, to mental health care for those who are seeking reproductive health services. And also our COVID-19 testing. There's a piece of this bill that is funding for continued COVID-19 testing, vaccinations, and other outreach for some of our federally qualified healthcare centers where they have lost federal funding, or that federal funding has not been extended. So that's a piece of this as well. So we're doing this bill was ready to go before the Supreme Court decision of last week, because we did not want poverty to be a barrier for anyone to get to their healthcare appointments. And in Missouri, we know that maternal mortality has been bad for Black women, particularly Black and Brown women in the St. Louis area in Missouri. And so we were set up and ready to go to try to allocate this funding because these particular groups of people were also most impacted by the COVID-19 crisis. So I have with me here a couple of folks that I would love to introduce to get involved with this discussion today. And as my speakers, we don't really have time limits on how long you can speak. I would love if you would just go forward with your presentation. We have Mallory Schwartz here with Pro-Choice Missouri. We have Dr. Love Holtz here also with Pro-Choice Missouri, and we have Lakeisha Reddit here. And I am sorry, Lakeisha, I just blanked on your organization. I know that you were a doula here as well to speak today. So I will go ahead and kick it off. I believe we'll move to Mallory to begin.
Mallory, I have to swear you in quickly. Do you affirm that you will tell the whole truth and nothing but the truth in your testimony?
I do.
Okay, thank you. Please proceed.
Thank you. Good morning, Alderman. Thank you for giving me the opportunity to testify today in support of Board Bill 61. My name is Mallory Schwartz. I'm the Executive Director of Pro-Choice Missouri, the state's largest pro-abortion reproductive freedom advocacy organization dedicated to promoting full and equal access to reproductive choices, including pregnancy care, bearing healthy children, and choosing safe legal abortion. On behalf of Pro-Choice Missouri, we urge you to support this legislation. The Reproductive Equity Fund, sponsored by Alderwoman Rice, and a number of you already on the call today. Thank you. The research and community outreach to support the development of this bill has been in the works for more than a year, both in anticipation of the now very real loss of abortion access in Missouri and to address the concurrent public health crises of the COVID-19 health pandemic and the maternal mortality crises. Missouri is ground zero for access to reproductive health care, even prior to Friday's news. With only one remaining clinic left in the state that provided abortions up till that point, patients would have to travel, facing a laundry list of harmful restrictions and barriers. And Missourians who choose to continue their pregnancies experience, as the Alderwoman said, some of the highest rates of maternal and infant mortality in the nation. Across the state, and of course most prominently here in the region, there are severe racial health disparities in outcomes and access to quality care. The goal of this fund is to address these inequities in access to healthcare and support pregnant people in all of their options. The very same person across their reproductive lifespan has a variety of needs, from carrying a pregnancy to term, choosing abortion, or experiencing a miscarriage. The St. Louis Reproductive Equity Fund would allocate ARPA funding to support access to the reproductive healthcare services identified as highest need by our own community members, including logistical access to abortions, as well as access to doulas and health advocates, support for establishing breast and chest feeding in the postpartum period, and access to mental health care throughout pregnancy and postpartum, as well as the numerous COVID supports for increasing access to care within the ongoing pandemic. This fund would be granted out to organizations already providing these direct services to support the region, allowing them to build up their infrastructure and increase their ability to serve a wider population. Critically, program funding would cover incidental costs, not direct costs of abortion. Missouri law prevents the direct funding of abortions, but this legislation will make funding available to groups, providers, community health organizations who support getting people to their abortions. Funds for travel, lodging, as other ancillary expenses. With this proposal enacted, St. Louis will become the 5th city nationally to grant or pledge municipal resources to fund abortion access. And St. Louis would be the first municipality to expand these efforts to support all pregnancy options. St. Louis would also be the first municipality to recognize the specific harm caused by the COVID-19 pandemic on reproductive health care access and direct ARPA funding to mitigate this harm. Importantly, localities have great flexibility in how they use their ARPA funds. There are few restrictions on them in order to allow cities like ours to meet the needs of their residents. Unlike other federal funding, ARPA is not subject to the federal Hyde Amendment that otherwise restricts funds. The ongoing COVID-19 public health crisis has compounded existing social and economic inequities as thousands of folks have lost wages, jobs, job opportunities, and we know that this job loss and workforce departure is not equally experienced. Women, Black women, and mothers are at the lowest workforce participation in 30 years. People who relied on employer health coverage are now without, in a time when providers are overwhelmed with the increases in patient numbers. And importantly, COVID precautions have also disrupted how we physically access reproductive health care, specifically care like annual exams, birth control, and of course, how people have experienced labor and delivery over the past years, which may cause people and families to reevaluate their preferred methods and access to reproductive health care. Public health is in crisis in the US, and as with so many issues, those most harmed are those who are already left behind by our institutions, people surviving paycheck to paycheck, Black people and people of color, immigrants, young people, those with disabilities, and the LGBTQ community. Board Bill 61 is an important step to address the concurrent crises of maternal mortality, abortion access, and the ongoing COVID-19 pandemic. It is an example of St. Louis leadership that we hope the nation will follow, and an example of what a public health response should look like. Community-directed, community-responsive, putting dollars back into the hands of providers in our region already working to better serve our community. The people closest to the problem are the people closest to the solution. This legislation is an important example of that, and we hope you will support today. I'm also happy to take any questions.
Alderwoman Rice, if it's okay with you, we'll hold off on questions until the end, or is that okay?
That would be great. Yep.
Okay, Dr. Love Holt, you're up next. Are you ready?
Yes, I am. Thank you.
Great. Do you affirm that the testimony you are about to give is the whole truth and nothing but the truth?
Yes.
Okay, thank you so much. You may proceed.
Hello, everyone. Good afternoon. My name is Reverend Dr. Love Holt. I use she, her pronouns. I am an organizer and a storyteller with Pro-Choice Missouri. I want to thank you all for giving me this opportunity to submit this testimony in support of Board Bill 61, So over the past year, amidst the ongoing COVID-19 pandemic, Pro-Choice Missouri conducted a broad community outreach. We engaged nearly 50 St. Louisans in intimate conversations around their reproductive health care during their pregnancies. The goal of these particular focus groups were to engage the direct community members on the direct impact of access or the lack thereof to reproductive health care with the intent of identifying comprehensive solutions. We've only threw up a topic and allowed each person to speak freely without guiding their conversation or telling them that there is an isolated focus on any need. And what came out of that was something that was very much disturbing. I facilitated every one of those sessions with primarily Black and brown women and pregnant people. And what I heard in these conversations was people were harmed by racism and bias in our medical systems. People who wanted doulas but couldn't get one because they couldn't afford to pay out of pocket. People who wanted to breastfeed, but they were, discouraged. They were discouraged by providers when they were asked for that support. People who choose abortions but were not able to get them because of money or lack of a car or because of disinformation perpetuated by Missouri politicians. All of these people who deserved access and advocates, they were denied because of poverty, institutional racism, Missouri's harmful laws, or some combination of the above. The people in our city are being continuously denied access to basic health care, including wanted abortions. And now with abortion being illegal in Missouri, this situation is only going to become more dire if we don't take action now. What I heard in these conversations were many stories like my own. In 2018, despite facing countless obstacles, I was able to get an abortion at a critical moment in my life. I had 4 children, stuck in a violent domestic relationship, and because I had low wage paying job, I didn't qualify for Medicaid. So I didn't have health coverage. As I sat in the waiting room at Planned Parenthood, I panicked because I knew I didn't have the money. And thanks to the politicians in Missouri, I had to jump through so many medically unnecessary hoops, delaying my care and causing me to have more expensive procedure. A procedure made even more expensive by the number of days I had to take off from work and the childcare I had to pay for. Ultimately, thanks to my supportive network and the support of Planned Parenthood and the Missouri Abortion Fund, I was able to get that abortion, but not everyone has the same victory. That's why we're here today, to help ensure all St. Louisans have the support that they need to get their appointments. Because so often getting there, the travel, the lodging, and for 60% of people who get abortions, they are already parents like myself, the childcare. My abortions helped me keep my feet firm on the ground as I took my children and ran from that violent relationship. It allowed me to be here to do the work that I am very passionate about today. Everyone should have that same support and opportunity that I had, because the alternative means ultimately being denied access to basic care. This is a devastating impact on the individuals and our community, especially because we know abortion access is directly related to maternal health outcomes. For Black and brown women, moms, and pregnant people specifically, already facing severe health disparities, already disproportionately harmed by the pandemic, and the threat of an abortion becoming even more inaccessible is absolutely devastating. So I'm grateful to be here today to tell my story, to support Board Bill 61, which addresses concurrent crisis of maternal mortality and abortion access by creating a municipal funding stream to support all pregnancy outcomes, including abortion. This work is a direct reflection of our community and the direct response to the named wants and needs of St. Louisans. Again, I thank you all for the opportunity to testify today. I'm asking you personally as a mom and an abortion storyteller, as an organizer, and as a leader in the St. Louis community to advance this legislation. There is no time to waste. Thank you so much. And that will be the end of my statement.
Thank you so much for your time. Lakeisha Reddit.
Good afternoon, everyone.
Good afternoon. Lakeisha, do you affirm that the testimony you're about to give is the whole truth and nothing but the truth?
Yes.
Thank you so much. Please proceed.
Hello, my name is Lakeisha Reddit. I use she, her pronouns, and I am a mom, community health worker, community doula, and chair of the St. Louis Doula Project. And I want to thank all of you for allowing me the opportunity to speak to you in support of Board Bill 61. The St. Louis Doula Project is a vast network of Black and brown community doulas in the St. Louis region who have banded together to ensure affordability and access to doula care remains a staple for all pregnant people in St. Louis through the lens of reproductive justice, and is central to our mission as an organization. We are the only doula organization in the St. Louis region who has committed itself to ensuring that abortion clients had had support when accessing safe abortion since its inception in 2019 by providing rides, physical support, and postpartum care. Members of the St. Louis Doula Project committed themselves without questions asked, providing this necessary service to those who were seeking support. Both increasing access to doulas and ensuring abortion access are critical parts of addressing the maternal mortality crisis, particularly for Black and Brown birthing people. The states with the most restrictions on abortion have the highest rates of maternal mortality, and Black and Brown pregnant people have rates of mortality 3 to 4 times higher than white people here in St. Louis City alone, which mimics the national statistics. With Roe v. Wade abolished through the Supreme Court, the threat for people like me and the clients I serve is even more severe, as Missouri providers would face a felony offense for providing abortions. I had a silent miscarriage myself in 2018 and had to have a DNC. But now, with no abortion available in Missouri and with abortion providers threatened with 30 years in prison, it terrifies me to think what could have happened to me if my doctor had refused to provide this care out of fear of going to prison. So we need our leaders to do everything they can to support getting basic health care. And this includes so much more than just the healthcare procedure. People's access to any healthcare shouldn't be limited by personal circumstance. Just think of all the ways social determinants of health impact people's ability to make a healthcare decision, such as access to insurance, safe and affordable housing, childcare, poverty, and more. And that's why Board Bill 61 is so important. Doulas are an essential part of the doulas are an essential part of the birth work network, and there's a high need for us in our region. And there's a trained and available workforce ready to serve pregnant people in our region, and we are evidence of that. However, doulas are not covered by insurance, including Medicaid, and we are often limited by lack of infrastructure, as we often operate as independent providers. So making funding available specifically for both logistical access to abortion and birth worker infrastructure will be critical, will be a critical way to support the capacity of existing doulas and would have a significant impact in the St. Louis region. As a doula, my goal is to support my client no matter what their decision, and I recognize how central abortion care is to pregnancy care overall. All people, whether choosing to have a baby or seeking support around abortion care, deserve support. So thank you for allowing me the opportunity to speak to you all today.
Thank you so much for your time. It's appreciated. We have a speaker from the member of the public, David Drury.
Sorry, Alderwoman Gracia, Chairwoman Gracia, would now be an appropriate time. I should have probably done this at the beginning, but we do have a committee substitute so that we make sure that we're taking testimony on the bill that we're going to be debating. Would now be an appropriate time to bring that forward?
We can do that now. I was going to wait until after the last speaker, but if you would like to introduce it, you can just walk us through and then I'll accept a motion.
Sure. Yeah, it's pretty straightforward. It's not super complicated changes, but it is in the drive for the members of the committee, and you received it 24 hours ago. There's the couple of changes are around. There's a little bit of a wording change up in section 2. Section 1. Section 1 has a little bit of administrative change. On line 11 says these grants will not be used to fund or assist abortion procedures, nor shall funds be used to encourage or counsel an individual to have an abortion. That is an edit there. Then down into section 3, line 15, these funds will be used to provide administrative oversight and evaluation for the Reproductive Equity Program and Fund. And then we did add a section 5 that is $500,000 of the ARPA funds to the Department of Health for incentive cards to support COVID-19 vaccination. And we had a lot of success with this in the community, encouraging people to get their vaccines. So we wanted to make that available for vaccines and boosters. So those are the changes that are in the committee substitute, but because there were so many, we just went ahead and did it in this form. So hopefully that gives us some clear language to go forward on. And
great, thank you so much, Alderwoman Rice. I would entertain a motion to put Board Bill 61 committee substitute in front of us.
So moved.
Second.
Madam Clerk, please call the roll.
Alderwoman Green,
Aye.
Alderman Gunther,
Aye.
Chairwoman Middlebrook,
Aye.
Alderwoman Rice,
Aye.
Alderman Todd,
Aye.
Chairwoman Gracia.
Aye.
6 aye votes.
Okay, now we have Board Bill 61 Committee Substitute in front of us. Mr. Drury, are you ready to speak? You're on mute.
Can you hear me?
Yes, I can. Do you affirm that the testimony you are about to give is the truth and nothing but the truth?
I was saying, maybe I got muted, that I was prepared to testify. However, I'm going to defer my testimony in light of the multiple changes and amendments of the bill. So you can continue to your next witness.
Okay, thank you.
You're muted, Chairwoman.
I know, thank you. I'd like to open it up for questions from the committee now. Alderwoman Green, do you have any questions for Alderwoman Rice or any of the speakers?
No questions today. Just I think that this is a very important piece of legislation given our current climate in Missouri and nationally. And I want to commend the Alderwoman from the 8th for bringing this forward. I think I am listed as a co-sponsor. If I am not, then please make sure that I am added.
You are.
Okay, thank you.
Alderman Gunther?
Thank you, Chairwoman. I also want to thank the Alderwoman from the 8th for this work. I would love to be a co-sponsor, I guess, if I'm not on there already. So please add my name to this bill. And thank you, Dr. Love, Mallory, and everyone for your work. It's very important work for now, obviously. And so I really do appreciate it. And I guess my only question, because I did see that there were in the committee substitute, $500,000 given for the incentives. Is it still a $100 incentive? Is that the number we're on?
Yes. Yeah, it'll be the same iteration of the vaccine gift cards that we've had success with in the past.
Okay, wonderful. Thank you again, and I appreciate everyone's work.
Alderwoman Middlebrook? Looks like we may have lost her temporarily.
I think she's still there. I think your introduction got a little jumbled, maybe. So.
Yes, thank you. I have no questions. Thanks everyone for being here. I would also like to be added as a co-sponsor. Thank you.
Thank you, Alderwoman. Alderman Todd?
First of all, thank you very much for being here, and thank you, Alderwoman of the 8th Ward, for sponsoring this legislation. I would like to be a co-sponsor.
Excellent. Thank you so much. I would just like to echo the kudos to the Alderwoman from the 8th for leading on this, and to all of you who spent time to testify today. We are living in incredibly troubling times, and the ability to fight back at the local level is more important now than ever. With that, Alderwoman Rice, I'd recognize you to close.
Thank you, Alderman Ingracia. I want to thank you all for your gratitude on this. I just want to acknowledge how much of a group collaborative project this was. This is not just mine. Alderwoman Clark Hubbard, thank you so much for your support and your standing with us here, standing for women and standing for reproductive services for all St. Louisans here. Thank you for all of the co-sponsors. Alderwoman or Chairwoman Ingracia, if there are other, I see we have lots of other members of the board here. I'd welcome if folks want to talk, or even, I have a feeling there may be a few more ads as co-sponsors if folks are wanting to do that too. But I'm excited that we have this opportunity to to do something, to, I think for a lot of us, even though we knew the Dobbs decision was coming on Friday, a feeling of hopelessness was easy to feel Friday morning, to feel like, we, I, for one, I was out of state. I was in Oregon last week, and I was in a state where my rights to my bodily autonomy were recognized. I had those rights when I left Missouri. I no longer have those rights when I came back. I mean, it is a really surreal feeling to know that my body does not belong to me anymore here in this state. And so I am grateful to be here with you all, standing with a tangible action that we can do to support the people of St. Louis, because we will not stop fighting for them. I have told everyone who was here on Friday and who was able to show up at a rally, show up in support at a press conference, that we will not go quietly. We are going to do everything possible to support all St. Louisans who need access to healthcare. We know for far too long we have not been doing a good enough job, particularly for Black mothers in St. Louis and for Brown mothers in St. Louis. We need to do better. We need to be building a world with access and choice. And I am grateful to be in this space with all of you. So thank you for this opportunity for St. Louis to lead, to use this money that is available to us to address the COVID-19 pandemic and the ways that it has impacted maternal health care. I'm grateful for the opportunity to be able to bring this bill forward.
Great. In light of your comments, if there's anybody not on the committee that has any questions or comments, please raise your hand. Happy to give you an opportunity to speak.
Hi, did you recognize me? Thank you so much. It didn't come up right away. Thank you so much, Chairwoman Gracia, for this opportunity to speak. I am in support of this bill. I am co-sponsoring this bill. I'm so grateful for Alderwoman Rice bringing it forward. I echo everything that she has just said about how completely terrifying this is, a terrifying time to be in Missouri, especially. And it's incredibly important for St. Louis to do what it can to be a safe space for people right now, and to promote anything, to do anything we can. And so I'm really happy to see that we are, and very grateful again for Alderwoman Rice bringing this forward. Thank you.
Thank you so much, Alderwoman. Alderwoman from the 17th.
Thank you, Chairwoman Gracia and the members of the committee. I just want to echo in terms of Mallory and everybody else in terms of how collaborative this was. And thank you so much, Mallory, for speaking to me regarding this and moving it forward. And I would like to commend Alderwoman Rice regarding taking the lead in terms of this. And this is so important. And reading the information and seeing who's affected, especially Black and Brown women and their families. So I do support this particular bill, and thank you so much.
Thank you so much, Alderwoman. Alderwoman from the 26th, you're recognized.
Thank you, Madam Chairwoman, members of the committee. I could exactly say what everybody else has said. Of course, we're all echoing, but it does make a difference when they know, when the people in the public know and see how collectively we are working on this. Thank you, Alderwoman Gracia, for answering texts and getting information out to us when we needed it over the weekend, and just the rallying and the tapping in and tapping out. This is exactly how this kind of legislation can give us hope, right? And so many of us are so heavy with emotions on so many different levels about the direction that we're going in this. But again, I think that yesterday was stated that this is a bold move, and we have some bold people standing and rallying behind and with us, and again, and next to us, right? And so I'm just excited to be on this. And I would also urge, I was telling some of the members before we started the meeting that yesterday, the press conference that was given with our Mayor Jones and Congresswoman Cori Bush, their press conference around this rally and their support behind this, that means so much. But the speakers almost took us out, running up out of room 200. So when STLTV posted, I encourage you all to go on there, read that, get behind this energy, get behind this this hope and this movement, clearly a movement. And thank you so much again for all of us, for all of the work and efforts, and especially for you, Alderwoman Rice, as we move this forward.
Thank you so much, Alderwoman. Mr. Drury, I just wanted to let you know that this is, you're able to submit written testimony after this, but this is the only opportunity for public testimony on this bill. Okay, I would entertain a motion to pass Board Bill 61 committee substitute out of committee with a due pass recommendation.
So moved.
Second.
Madam Clerk, please call the roll.
Alderwoman Green,
Aye.
Alderman Gunther,
Aye.
Vice Chair Middlebrook,
Aye.
Alderwoman Rice,
Aye.
Alderman Todd,
Aye.
Chairwoman Negracia.
Aye.
6 aye votes.
By your vote, you have sustained the motion from the Alderwoman from the 15th and passed out Board Bill 61 committee substitute with a due pass recommendation. Congratulations, Alderwoman Rice. All right, is Alderwoman the third here?
Yes, I am.
Good afternoon, Alderman. You ready to go? You're recognized on Board Bill 65.
All right. Thank you very much. I appreciate you, members of the committee. Thank you very much, Madam Chair. Board Bill 65 is one of the things that we have for some time been looking to figure out how it is that we can fund. We all know that there's a lot of violence going on within our city. We've tried multiple times in multiple different capacities to try to deal with the violence that's going on. One of those things with the Cure Violence program. We all know that there are multiple different factions going on throughout the city within our areas that Cure Violence can't necessarily, with the funding that we've given it thus far, kind of deal with the capacity of all the different issues and problems that we have throughout the city in general. All of these different wards have different problems, and all of these different wards also have grassroots organizations who are implementing different things within the communities on the several blocks that have violence, because every single block does not have violence within these areas that we're talking about, but those that do, there are grassroots organizations all the time that are doing the work out there, doing camps. They are out there working very diligently within the streets, within like Brother Seals. He has his church out there bringing different individuals into the church that are looking for a way out of the streets, that are also into prostitution, into drug rings, that are looking for different changes. And these are the individuals that this particular board bill is targeted towards. We always talk about there is no funding for the grassroots organizations. We go out here and fund the big ones, and then what happens after we fund the big ones? And we say that there's just not enough going on, and that has been true. The big ones do a very, very excellent job, but there has to be a well-rounded approach to violence itself, because it does not come in and out of the front door. It comes from the side, the windows, up under the grass, however it happens. Wherever there is a atmosphere, violence makes a way to find out how to manipulate that atmosphere. And what we're trying to do is make sure that the individuals who live in these communities where that atmosphere is being created have the ability to help control that atmosphere that they live in. And finally, there is some sort of funds that the taxpayers don't have to deal with, because every single individual's, not every single individual, but every single block and every single neighborhood in the city isn't dealing with the same type of violence. So, with that being said, it's a blessing from the federal government for us to be able to have this type of funding the mayor's office is saying that we need to earmark it particularly for the safety of the city of St. Louis and ensuring that the inhabitants here who are dealing with, I believe, one of the most biggest and pressing problems within our city. We can have the most amazing structures, the most amazing people, but if we can't protect those structures and those people first, then we all are failing. So that is once again what this board bill is about. It is $10 million that is supposed to be from the ARPA funds, and it gives ourselves in the mayor's office the ability to look at different grassroots organizations, different programs that are going on within the city of St. Louis. Well, not necessarily the mayor's office, but the different departments that they oversee. But of course, that's the mayor's office at the same time, but us at the same time. We all have that ability now to look at those grassroots organizations and see what it is that they are doing to be impactful and see how it is we can elevate their impactfulness. So with that, we do have some speakers from the mayor's office. I'll let you, Chairwoman, call those folks down. I don't have the list in front of me.
All right, thank you so much, Alderman. If you could do me a quick favor while your speakers are testifying. I received a committee substitute for this bill after the committee hearing started from Kevin Bailey in the mayor's office. I think the most important change is that on page 2, section 3, in one place it says $1 million, in one place it says $10 million, but there were some additional changes. So I don't know if we want to work on those as amendments. We can do that and maybe take a quick break after your speakers testify and the board asks questions, or we can hold off and schedule another meeting later this week. I know that there's a sense of urgency to get this money out on the street, and we do break July 15th. Do you have a preference?
Oh, absolutely. If we can just work on them as amendments. I know, so the first two were in the whereas, so is there possible for us to just do those as scribblers errors and
I think it's too much for Scrivener's error.
Okay.
And I did email Mr. Bailey and ask him to text me. I haven't heard from him yet. So if you could help me work on that, we can always take a break and come back. So we can make sure we can move this forward this week. So why don't we go ahead and have Dr. Daniel Isom from Public Safety. Do you affirm that the testimony you're about to give is the whole truth and nothing but the truth?
I do.
Okay, please proceed.
Thank you, Madam Chair and members of the committee, and certainly Alderman Bosley for bringing Bill 65 forward. This legislation will establish the Office of Violence Prevention, which will be in the Department of Public Safety. It also allocates $10 million to expand violence prevention program in the Department of Public Safety. And later after I speak, Will Pinckney will talk about the allocation of $3.6 million to the Department of Health and the expansion of summer youth programming and for year-round youth programming. As you all know, we're making significant investments in community violence prevention to address the root causes of crime. So far, the Board of Aldermen has allocated $5.5 million of ARPA funds to support CVI programming. This funding is allocated to 8 different providers for this year with the option for renewal. The current funding will cover the initial renewal. Just to give you a sense of the contracts that have been approved for this initial round of funding, and some of these organizations you might be aware of, the T, which does wound care for individuals who are victims of gunshot wounds, but also the psychological trauma that they deal with as a result of being victims of violence. We also have a contract that's approved for our legal services of Eastern Missouri. Part of the cycle of violence is getting out of the criminal justice system and dealing with any legal issues that might have you trapped. Those are in sort of the non-traditional CVI types of programs, but Mission St. Louis, which has done work in our area for a long time, Urban League, Employment Connections, Freedom Community Centers, and also OBS have followed the line of more traditional community violence interruption Those contracts have been funded have been approved by ENA as well. The last organization is Divas, which really focuses on domestic violence within the community. The forthcoming ENA meeting in July will hopefully approve this contract. So those are 8 different providers who are doing CVI work and will be doing CVI work based on the existing funding that we have. However, as Alderman Bosley said, we need significant monies to expand these CVI programs beyond 2024 to 2026. There are many different areas and many different organizations who are providing CVI work. In our latest round of proposals, where we selected these 8 new organizations, at least 5 of them are new. Urban League and Employment Connections have had a contract with us before. We had 20 additional applicants who applied to have funding for their CVI work within the city of St. Louis. So we know that this is a multi-pronged approach to dealing with violence, both from a criminal justice standpoint, but also a violence intervention and a health standpoint. Last year, we were successful as a community as a whole in reducing homicides by 25%. Cure Violence, of course, is the primary vehicle in terms of CVI programming that we've had in the city of St. Louis. The city invested in Cure Violence program over a 3-year period for the amount of about $5 million. Right now, I think most people are aware that these programs are only in the Wells Goodfellow neighborhood, Hamilton Heights, Walnut Park West, and Dutchtown. Although they have been successful in resulting in 482 interruptions, and the programs have 200 plus people on their caseload to date and interacting with about 13,000 community members in the course of their work in the city of St. Louis. Establishing the Office of Violence Prevention will allow us to coordinate our efforts to address violent crime between the Department of Health and the Department of Public Safety, while providing the capacity to research funding sources that move us beyond the ARP funding. So it would also give us the chance to work collaboratively with other cities who are engaging in CVI work, places like Chicago, LA, Baltimore, Atlanta, Detroit, Philadelphia, Memphis, Newark. All of these cities are working to use CVI to address the root causes of crime and hopefully have sustained reductions in violence across our cities. So I will turn it over to Will to talk about the youth programming.
Great, thank you so much, Dr. Isom. Will, are you with us?
Yes, I am.
Great. For those of you who don't know, Mr. Pinckney is the director of the Mayor's Office of Children, Youth, and Families. Do you affirm that the testimony you're about to give will be the whole truth and nothing but the truth?
I do.
Great, thank you. Please proceed.
Thank you. I just want to touch on just nationally, just to talk about offices of violence prevention, to give the committee a view into what they tend to do and how they're structured and how what we're doing is similar to that. I would just start by saying public safety is a system in and of itself of many different actors, and those that you all have pointed out, including Alderman Bosley, families, churches, schools, and all types of community organizations. When we think about public safety and we think about community violence intervention and offices of violence prevention, we think about co-production of public safety. Offices of violence prevention across the country really look at evidence-informed strategies to reduce violence through community-centered initiatives. Those community organizations and those strategies are focused on preventing and disrupting cycles of violence and trauma, establishing relationships between individuals and community service organizations that focus on the physical, social, emotional needs of people in those communities. We have been working with the National Institute for Criminal Justice Reform, and we also, through them, we became part of an Office of Violence Prevention network. These offices throughout the country really work to distribute community grants grants to community organizations, as Alderman Bosley said, really those people working on the ground, to be able to allow them to continue to do the work that they do, at the root of where violence is perpetrated, and to address root causes within those communities. The efforts focus around victim services, around youth justice, around reentry, really looking at intervention, prevention, and community mobilization. And so the office here will be set up in a way that mirrors the best practices of offices of violence prevention throughout the country. In pivoting to the youth programming aspect, we've been fortunate enough to work once again through many national networks to look at our out-of-school programming. We focused mostly on summer programming the last 2 summers. Last summer, we were able to work in conjunction with the schools and about 27 other community organizations, establish 5 sites in SLPS schools in communities. We identify those communities using data to identify gap areas. Obviously, the money isn't enough to address all the problems, but it does allow us to put programming where it's needed most. This summer, we were able to expand the number of sites to 8. But one of the things we haven't been able to do or focus on, because we haven't had enough money, is focus on after school. There are a lot of great community organizations doing after school work, but once again, this money will allow us to extend what we're doing, but also to expand to offer any after school services in areas where families don't have that opportunity. As you all know, there's never enough slots for the need. And so as much as we can provide in working with community partners, extra slots in the times when families need it so that they can work or so that they can have peace of mind that their children are in a safe place, that is what we will do. And in providing those slots, we always make sure that our community partners have a social worker on staff so that we can, where appropriate and where needed, address the needs of those children and their families as it relates to the trauma that has been inflicted on them by any violence they may have been primarily or secondarily exposed to. So I will stop there and turn it back to you, Alderwoman.
Thanks so much for the work you're doing. I move to the committee to see if anybody has questions or comments. Alderman Gunther.
No questions right now, thank you.
Alderwoman Middlebrook. Alderwoman Rice.
Thank you. I think the explanation was great. I commend you both, Mr. Pinckney and Dr. Isom, on the work that you're doing. I know that this is vital work, and the work that you've done up until this point has helped us, helped our youth, helped our families, helped our communities, and continuing that good work is important. I'm grateful for the creative and forward-thinking usage of this money. We know that COVID-19 and the effects of folks losing jobs, losing income, losing after-school activities, things that they would have normally done, all create an environment that could lead to more violence. And so interrupting that and really working with our best tools to make this a safer city for all of us is really commendable. So thank you so much for your work, and especially for your investment in the city of St. Louis.
Thank you, Alderwoman. Alderman Todd?
I don't have any questions, thank you.
Okay, great. I guess what we'll do now is, Alderman from the 3rd, do you think by 2:30 we would be able to get some amendments together and come back?
Yes, ma'am. So thankful for our amazing clerk and staff. They are working on trying to figure it out now. I really appreciate them. They are working very diligently. My apologies for not having all this together. We saw a few errors. I thought we'd be able to kind of knock those out, but so I'm never trying to waste the committee's time or anything like that. So I do appreciate everybody, sticking with us if you can.
Sure, no worries at all. Thank you for getting it done, and we will recess until 2:30 p.m. We'll come back and introduce the amendments and then take a vote.
Okay, sounds like fine. Thank you.
Okay, we'll call the meeting back into order, and please feel free to proceed.
Thank you. So unfortunately, I am doing this off of my cell phone. I'm sending it to my other one. So if I do pop out, it's only because when you look at your phone and you actually kind of go behind and go into your email, it turns your camera off. So I am here, in no way not, trying to not be in front of the committee, but it's not intentional. I just wanted to put that out there.
Sure, no worries at all, and I'm happy to support you if for some reason you need me to read anything from the drive or do anything else to help. So we took questions from the committee, we went through all of that, and now could you present Amendment 1 to Board Bill 65 to us?
Yes, ma'am. Okay, I'm trying to pull it up with this phone. I'm sorry.
Is it more helpful to you if I read it, Alderman?
Yes, ma'am, it is. Thank you.
Okay, yeah, I'll go ahead and do that. Okay, so amendment number 1 to Board Bill 65. We're amending page 1, line 5 to line 8 as follows. Strike out the words, whereas the city received $240,038,027 in 2021 from the Coronavirus Local Fiscal Recovery Fund under ARPA. Okay, there's a blank here. Do you know why there's a blank in that space?
So that's supposed to be forward with what's in parentheses there.
It was blank in the originally filed bill. So the blank in the amendment at the top, like, so you're reading the line, the information that is being struck through. So we should be
so no worries about it. Okay, from blank such fund in the calendar year 2022, collectively the ARPA funds, and insert in lieu thereof to read in words and figures as follows. Whereas as on June 9th, 2022, the city of St. Louis received the second installment of ARPA relief funds, $249,038,027 from the federal government pursuant to the American Rescue Plan Act of 2021. March 11th, 2021, the Coronavirus Local Fiscal Recovery Fund, and that ends the amendment. I would entertain a motion to put Amendment 1 before us.
I move we adopt Amendment number 1 to Board Bill 65.
Second.
Previous roll.
Hearing no objection to previous roll, Amendment number 1 to Board Bill 65 comes before us, or is incorporated into Board Bill 65. Let me read Amendment 2, sorry. I lost my.
Thank you, Chair.
Of course. Just give me 1 second, I apologize.
Chairwoman Gracia, I have it in front of me if you want me to read it.
That would be great. Thank you. My computer is not opening up my email. Appreciate it.
No problem.
Madam Clerk.
Amendment 2 to Board Bill 65 to amend said Board Bill page 1, line 9 to page 1, line 10 as follows. Beginning on page 1, line 9, strike out the words, whereas the city previously has appropriated blank of the ARPA funds and insert in lieu thereof to read in words and figures as follows. Whereas as of June 28, 2022, the city of St. Louis has appropriated $248,775,000 in ARPA relief funds towards revenue placement, direct relief, infrastructure, and economic justice through ordinance number 71345, ordinance number 71393, ordinance number 71494, and ordinance number 71504. And that's the end of Amendment 2.
Thank you so much, Madam Clerk. I would entertain a motion to accept Amendment 2 to Board Bill 65.
So moved.
Second.
Previous roll.
Hearing no objection to previous roll, Amendment 2 to Board Bill 65 is now before us or has been accepted as part of the bill. Madam Clerk, would you, oh, actually, I found it. Amendment 3 to Board Bill 65, to amend said Board Bill, page 2, line 16 to page 2, line 16 as follows. Beginning on page 2, line 16, strike out the words one and insert in lieu thereof to read in words and figures as follows, 10. I would entertain a motion to accept Amendment 3 to Board Bill 65.
So moved.
Second.
Previous roll.
Hearing no objection to previous roll, Amendment 3 to Board Bill 65 is now incorporated into Board Bill 65. Does anyone on the committee have any questions for the sponsor regarding the amendments that we just adopted? Alderman from the 3rd, you're recognized to close.
All right, well, once again, I really appreciate you all. Thank you all very much for your consideration. Thank you to the clerk and everybody for your patience with the bill today. Thank you very much, Chairwoman, for helping clean up here the end of it. Thank you very much for everyone. So once again, this is a bill that I believe is extremely important to the health of the city. We all are trying to make sure that we change where it is that we are trajected to go in the next few years in terms of where our violence is going. Everybody's trying to figure out what that path looks like. We all know that it takes a few dollars to make sure that we're helping those grassroots organizations help complete and achieve those goals that they started off achieving to help reduce some of that violence that we are trying to work on reducing here within the city. So these dollars are meant for that particular cause. And with you all's help, we've finally gotten this bill to a place where it looks like it's legally able to be moved forward. And I ask for your favorable consideration for it. And thank you all very much.
Thank you, Alderman. I'd entertain a motion on Board Bill 65 as amended.
I move that we pass Board Bill 65 as amended out of committee with a due pass recommendation.
Second.
Previous roll.
Hearing no objection to previous roll, Board Bill 65 as amended comes out of committee with a due pass recommendation. Congratulations, Alderman Bosley. This is really important for the city. Thank you for leading the charge on this one.
Thank you very much. Thank you so much, Chairman. Thank you so much, members of the committee.
All right, we will dispense with line items 5 through 6. Do we have any announcements? All right, we have all members were present today to entertain a motion for adjournment.
I move that we adjourn.
Second.
All in favor, signify by saying aye.
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 All right, have a great day, everybody. I think we did some really important work here today. Appreciate the time that you've spent with us.
Thank you.
Thank you.